Hey, it's Mark Terrell from the Shortcoat Podcast at the University of Iowa, Carver College of Medicine. And this is the Shortcoat Short on how to get the residency you want. Now remember, before we get started, the info we're giving you is just a start. Be sure to know the programs you're applying to and what they want specifically, and get help from your mentors, deans, trusted advisors, and what have you. And if you have any questions we can answer, definitely call the number below. Or ask in the comments and we'll see what we can do. And a special thanks to our own Medical Student Counseling Center for setting this up with us.
I'm Tyler Rasmussen, a M6G in the Carver College of Medicine, and I'm here today with Dr. Katie Harris and Dr. Nicole Grogan. Dr. Harris is the Associate Director of the University of Iowa Hospitals and Clinics Internal Medicine Residency Program and a Clinical Associate Professor of Internal Medicine. Dr. Nicole Grogan, who is an intern in the Department of Internal Medicine. Both are graduates of the University of Iowa Carver College of Medicine. Thank you so much for being here today.
Thanks for having us.
Let's get started. Dr. Grogan,
First question.
how did you decide on a career in internal medicine?
Well, that's a good question because you're going to get a lot on the interview trail, so I recommend knowing what to say. I liked my internal medicine rotation a lot third year, especially the inpatient portion, and I realized that I really enjoyed challenging patients and people who had a lot going on and working through each of those problems. And I also really liked having a relationship with patients, and I felt like in internal medicine, you spend so much time because usually people are so sick or have so much going on that you really get like that great doctor-patient relationship. And so I was kind of sold when I fell in love with my first internal med patient, and I never looked back.
So Dr. Grogan, you just went through the interview process not too long ago. What was the best part of the interview process for you?
Food.
Free food.
Free dinners were really good. It's a balance, right? Because eventually the travel gets exhausting, but it is really fun, at least in the first couple interviews, to get to see all these cool places, get to see other hospitals, and really you get to meet a lot of people. And so I've met people from across the country, and I like to talk. And so I think that kind of fits things that I enjoy. But definitely free dinners was up there is kind of the best part.
Mm-hmm.
So you mentioned travel. About how many interviews did you go on?
I did 9, but for me it was very important to go to both coasts. I wanted to see, I kind of grew up in the Midwest and I've been at Iowa for a long time, and so I really wanted to challenge myself to see what other regions of the US would look like and what residency there would look like. And so I did 9, but 3 of them were on like opposite coasts, and so the rest of them were in the Midwest.
What was the most challenging part of the interview process?
I think the fatigue, interview fatigue is real, and you don't think it's going to happen to you, but it will. Mm-hmm. So I almost canceled my last interview, and I'm glad I didn't, but I think spacing them out and not putting too much on yourself, not too many interviews in 1 week is really important, because you kind of have to be on your game for like a 36-hour period between dinner and then finishing the interview the next day, and after travel and kind of researching programs, that's a lot of time. So I think it just can get a little exhausting.
So Dr. Harris,
Yes.
in general, what are you looking for in an applicant to your program?
You know, I think I really like just seeing people who are genuine, who are kind to people, and I think that will be reflected in their patient care. Hardworking, and really willing to work in a team. Medicine is such a team sport, if you want to say it that way. You know, and so really interacting with other people is so important, and so we really look for that. I think obviously you have to somehow narrow the pack down. And so we do have to use board scores to a point, but honestly, once you get the interview and once you're there, it's really just, you know, I call it the sandbox test. You know, can you play well with others? And that's what we're really looking for. And I would like to emphasize on that, it's not just how you interact with the people you're interviewing with, but the people who are showing you around and the people who are taking you to dinner. And if you're really nice to me during our interview, but you're a jerk to one of our support staff, like that's your true colors. You know, those are your true colors. So we take all of that into account.
So this leads into my next question. What are some mistakes you've seen on interview day?
Don't be a jerk. No.
Cell phones. Put your cell phone away.
Yeah. Yes, yeah. And, there are a lot of, at different places, they'll have different presentations and different talks and noon conferences. I've seen people fall asleep during those. I've seen people on their phones texting. I think, one of the tendencies is that you want to look stuff up on your phone, and you may have the best intentions, but when we see that in the back of the room, we think you're not paying attention and you're not interested.
It's hard because I haven't interviewed people, so I don't know what mistakes they make from that end. But I think from our end, I think being really shy and quiet is a disservice to yourself. It might not necessarily turn off a program, but I think it's such a good opportunity to meet other people and really get a feel for what a program is like, because you see that best in how you interact with the residents. And so I think personal mistakes are probably not taking the time to really have those conversations and see if you fit with the people of the program. So I don't know if this is necessarily a mistake, but I wrote my personal statement about wanting to do a specific specialty, which I thought I did want to do at that time. And then I did the rotation after I submitted and hated it. And so I was, kind of keyed up with all of these types of doctors that wanted to hear about how much I liked their specialty, and then I didn't. And so most of them were understanding and were like, a lot of people change anyways, you don't hold people to this. But I think it gave me an extra challenge of how to politely be yeah, I don't really see myself doing that anymore. And so I think that kind of gave me a little more anxiety, but I don't think, maybe eating too much. I really like the food, but otherwise I don't know about mistakes.
That is something though, don't get drunk.
Oh yeah, don't drink too much.
Don't.
I didn't do that, but
I know it, we laugh about that, but it happens, and it gets back to us. And we hear about it.
So the program directors and faculty have your file as an applicant. Can you assume that they've read that thoroughly and know your accomplishments, or is this an opportunity for you to sort of brag a little bit so that they know what you've done and what your motivations are?
So I do think it's a time to brag. And I don't know, I say that as a Midwesterner, and I think we're all very hesitant to brag. But I think you really do need to, say all of your accomplishments. In our program, people would interview with myself and the program director, and then also with other faculty interviewers. And I can't guarantee that the faculty interviewers have read everything. Dr. Sinasia and I have. But I still love to hear about, certain, global trips or, missions that people have been on, or their accomplishments in research. And so usually I'll ask about that, and I really think that that's a time to really play it up, and tell me about it and be proud of your accomplishments. And I guess on the other side, there are the people that they want to reiterate every moment on their CV, and I'm I read that. It's I don't need to hear about 12 years ago when you got a gold medal in your soccer game, or so. So there is that. I feel like I'm kind of speaking on two sides, but I do think it's time to sell yourself.
Okay.
And I definitely had some interviews where I remember I walked into one interview and he looked at me and he was like, "You don't look like your picture." I was like, "Well, yes, I do." And so he had read the entirely wrong file, it was for someone coming next week and not me. And so I think that makes an interview a lot harder because they have no context for who you are or anything about you. And so I think there's a happy balance, like Dr. Harris was saying. You kind of want to reiterate what's most important to you, but you don't need to rehash every volunteer experience you've ever done.
How did you organize and keep track of interviews?
I did do this. I had a Word document, and each program I went to, I listed pros and cons, and kind of what I liked about each program. And I thought that was really important because they all start to blend together at a certain point, and you really do lose track about what you liked about each thing. And so I just made sure at the end of the day, I just kind of wrote in just a few things about my favorites and my least favorites, and then I really did go back and look at that when I was making my rank list. Everyone should do it because it's super helpful.
Yeah, and so I did the same thing a few years ago. And I also recommend having like one person that you call after each interview and kind of just dump, like do kind of the brain dump. For me, it was my husband. A lot of my friends would call their mom or their dad, or some significant other or insignificant other, whatever. But just someone, so that then you can go back and then they'll be like, wait, but didn't you say that that one had like a mean program administrator or something, you know, because it's surprising how much they'll remember, because there's a lot of visceral feelings after these interviews, and to have somebody else kind of listening to that, I think is helpful.
So when it came down to it, how much did you use the scientific data you had compiled versus the sort of gut feeling you got from the program?
Oh man, I was like a total gut feeling. I had like 2 programs that I loved all the residents, and it was really, I mean, I fully believe you have that feeling about programs, and so there were a few programs that I had the negative feeling and I didn't even think twice about, even though they were technically like superior programs to some of the other ones. But I definitely, it's like, you know, the love at first sight kind of feeling, like you don't know how much to believe in it until you have it, and then you're like, oh, this is what it feels like when I really just love a program. And so I wrote down everything, and I think it's important to keep track of that, but the programs I kept coming back to were the ones I left that day and I was like, wow, like this is what I want and I can see myself here.
So to either of you, after you interview at a program, there's questions about how do you follow up with the program and let them know that you may be interested, and what feedback might you expect from a program that would be interested in you?
So I'll say from our program, actually, there are new guidelines out that came out from the Association of Program Directors for Internal Medicine. And we are conforming to these guidelines, where we do not contact applicants after the interview. We do not expect nor want thank you notes. We do not require or encourage second visits. So really, from our side of things, you won't hear anything. If you have specific questions, we're happy to answer those. But really, in the past, there have been a lot of problems with misleading statements from programs. So saying like you're ranked to match, or you're in the top of our list, and then students wouldn't match there, or the exact opposite, where students would say, you're my top choice, and then something happened and they weren't. So we really are trying to step back so that there isn't that confusion. And it's not because we're not interested in the applicants, and I try to get that across whenever I'm talking with applicants. It's more just we're trying to kind of level the playing field and not kind of have any coercion or misleading statements.
So out of curiosity, if I were to send a thank you letter to the program, what happens to it?
So I still read them, and it's one of those things where we don't want you to like waste your time writing all of these things. And I love thank you notes in my personal life. I think it's so polite and proper, and but I think in this situation it's not going to give you an advantage or disadvantage with our program. Certain programs, though, I would say are not in these guidelines. So the safest route would probably be to write a thank you note.
And is there a preference from the standpoint of a program director, whether it's a written note or an email? No. I guess email is nice because then you can just file it. Okay. And so I don't have to keep the paper, but I'm old school, so I like paper too.
There is like a lot of inappropriate communication still out there, and so I think that's something you should know going into interview season. You will get "we want you" emails, and you'll get emails that you're like, how can they say that? And then you'll feel bad when a program you really do like doesn't email you back. And so I think that remains, I know they're trying to make it less of a source of anxiety, but I think it still remains one of the biggest sources of anxiety during interview season, is that kind of post-interview communication. So I did send, I think I even sent thank yous to Iowa. Yeah. Towards the end, I got kind of sick of writing generic thank yous, so I did save them more for the programs that I did really enjoy or have a great experience. But some programs will say, don't email us. And when they said that, then I didn't email them. but there is that gray zone of you'll still be getting communication and it will cause anxiety. And so I think if you want to avoid it all, you can just not say anything, because I don't think it helps you at all. I think if anything, the response is just feed a little more of your neurotic med studentness. And so I don't think it'll hurt you on a rank list to not send a thank you note necessarily. Right. If you're going to, I think just know that sometimes you'll hear really good things and sometimes you won't. And at the end of the day, I don't think it affects your where you were ranked at all.
And we really want the rank list to be for you guys. You guys should rank where you like the best, not where you think a program, like which program you think you'll match at. So it really should be to your advantage. So anything you send to us, it's not going to, we get plenty of "you're my number ones," and honestly, I'm kind of like, is that true? I don't know. So it doesn't matter. I'm not going to move people up and down the rank list based on that.
So now I know, now that I've been an intern for all of 3 months, I realize how important the community of the program is and how collegial the program is and how important working with nice people is to me. Because when you're an intern and you're new, everything's kind of scary. So when you're calling a consult and they're mean to you, you just feel even worse. And that doesn't really happen here. I think I didn't realize how important that aspect of a program was to me until I became an intern and realized that, hearing about the programs where maybe support staff isn't as helpful or, nursing staff isn't as nice. Like here, if you ask for something, they'll do it. And I've heard that's not really a universal thing. And so now I'm glad that I was drawn to a program where everyone was just so nice and helpful. But I don't think back when I started interviewing, it was like the first thing on my list to really consider when I was at the interview.
Each student probably has an idea of what the ideal program would be. But as students look at programs, what are some hallmarks of a good program? And are there any red flags that should tip students off to a program that may be malignant or one they want to avoid?
When you ask someone what the best thing about the program is and they tell you it's the city it's in, that was like the biggest red flag for me, because there's one program I went to and you'd be like, oh, what do you like about the program? Because you want to know from the residents, and every single resident was like, well, it's in this cool city. Well, that's not good enough for me. I want better things to be about the program itself, not just that I can go surfing on my day off. And so I think not that I want to surf, but cool. I think from that end, that was a big red flag for me.
Okay. I think trying to feel out how important education is in the program is important. I think some programs, the residents are the workforce, and so you are there to provide care, and education is maybe a little bit lower down on the whole spectrum. So I think asking about how important education is, and you can ask that in different ways. Just do you have for especially asking residents, do you have time to go to conferences, and do you have any extra conferences that you get to go to, and things like that. I think will be important. And I really think your interactions with the residents on your interview day and the night before are really important. And if they're very limited or you never get to see an intern, that should be a red flag because they're too busy or they're being kept away from you for a certain reason. And that's always concerning, I think, for just programs that are very work-driven, I think. And I just think the atmosphere and the people, and so I think asking the residents, do you guys hang out outside of work? And if you have a significant other, you can always ask about if they have any programs for spouses or for significant others, because I think if you're moving with a spouse, you need to remember that and keep them in mind because it's a big transition for them too.
I think it's important to ask residents their least favorite thing about the program, and that kind of framed, wow, the only thing you can complain about is parking, okay, that's really not that bad, versus, oh, some people aren't friendly here, oh, you have a hard time getting things done and finishing your work on time, and I think can really frame how you think about a program.
You know, and I think one more thing, sorry, I just had to think about that, but so innovation in a program I think is really important. And so is the program changing? Are they trying to get better, or are they kind of just resting on a reputation that they've had for 25 years? So I think one question I actually like getting from applicants are just, you know, what big changes have happened in the program recently, and what changes do you see upcoming? Because if the program directors haven't thought about that, then there's, you know, if they just say, well, everything's great right now, I mean, you know, you're always striving to make it better. So that should be important to them.